Starting us off in this panel is Alexandra Gross, who also presented in our last panel. She's a writer and researcher with a Bachelor of Arts in Sociology from Mount Royal University in Calgary, Canada. She is currently pursuing a master's in social policy at the University of Bath in England. Her primary areas of interest include education, social inequality, and history. And so here she is with her presentation on biopolitics and social detriments of the COVID-19 pandemic experience, understanding its impact on Indigenous peoples in Canada. So take it away, Alexandra.
All right, so as Jess said, this time I'll be talking about COVID-19 and Canada's Indigenous communities. So to start, I'll just provide a brief overview of the format. So I'm going to start by talking about the data we have on COVID cases in Indigenous communities and some important terminology. And then I'll talk about the main determinants that affect how these communities are impacted by the virus. And then I'll finish off just by talking about what's been done to minimize the impact on these communities and what needs to be done going forward. So I want to start by talking about the quantitative data we have on COVID and Indigenous communities. So according to data collected by Indigenous Services Canada, there have been 438 confirmed cases of COVID in Indigenous communities to date. When compared to rates for Canada as a whole, we see that the Indigenous population appears to have positive COVID cases at 1/4 of the rate of the rest of Canada. This data also indicates that Indigenous fatalities are currently at 1/5 of the rate of the rest of Canada. So at first glance, it appears that they're doing really well. However, these statistics are misleading. So these data are only collected on First Nations individuals living on reserves, which only comprises about 20% of Canada's Indigenous population. So the other 80% have become anonymous under the COVID data for Canada as a whole. So as an example of why this is problematic, back in May, a Métis village in Saskatchewan reported over 100 COVID cases, and these weren't included in the ISC data. So we're completely missing data on Indigenous persons living in urban areas, as well as First Nations, Métis, and Inuit communities off reserve. So essentially, we just don't know the impact of COVID on this population as a whole. So we tend to think that disease doesn't discriminate, but health risks and outcomes are actually greatly determined by social factors, and we call these social factors the social determinants of health. The COVID-19 pandemic has both exposed and exacerbated pre-existing social inequities within Indigenous communities, and it is these social inequities that have made the Indigenous community more vulnerable to disease outbreaks in the past. Due to this repeated history, Indigenous communities have not underestimated the risks associated with the pandemic, and they've taken steps to protect themselves. And I'll talk about these steps in more detail at the end. So for the rest of the presentation, I'm going to talk about the main social determinants that are the root cause of how Indigenous communities have been impacted by the health threats of the virus itself, as well as the wider economic implications of the pandemic. And due to time constraints, I can't always go into a lot of detail about the reasons behind the data, but if you have any questions about that, just feel free to ask at the end. So the first determinant we're going to talk about are rates of poverty and violence for the Indigenous population. And poverty has an effect on all the other determinants I'm going to talk about, including healthcare access and food security. So as you can see on the left here, 20% of Indigenous households make under $20,000 per year. And the reasons for this are complex, but generally the main causes are a lack of economic opportunities in remote communities and low educational attainment due to systemic barriers. The pandemic has further reduced employment opportunities, so communities that were already struggling economically will be even more greatly impacted, not just during the pandemic, but will also struggle to recover post-pandemic. In terms of violence, we see that Indigenous women are 2.5 times more likely to experience violence compared to non-Indigenous women. Research on past epidemics and pandemics, as well as current data we have from women's shelters across the country, indicate that violence against all women increases during these uncertain times. So Indigenous women are likely to experience an even higher rate of violence than they were before. Moving on to living conditions, I'm going to talk about housing and technological infrastructure. So on the left, you see that compared to Canada as a whole, there is a really large percentage of Inuit and First Nations individuals living in overcrowded housing. And by this, we mean housing that does not have enough bedrooms to accommodate the number of people within a given household. There's also a large percentage of Indigenous households needing some level of repairs. So as you can see on the right, 46% of Métis households need repairs, and over half of First Nations and Inuit households need repairs. So then in terms of COVID, this is problematic because in overcrowded housing, household members cannot isolate themselves if they become sick. So the virus is going to spread amongst all members. Housing is also often multi-generational, so the elderly are unable to isolate. Overcrowded and poorly constructed housing also leads to damp conditions, which leads to mold. And being exposed to mold on a regular basis can cause adverse respiratory effects and a compromised immune system, therefore making them more susceptible to COVID. And then there's also the issue of internet connection in remote communities, particularly Inuit communities in Nunavut. Internet costs are often high, and a lack of reliable connection is a barrier to being able to work from home, as well as a challenge for students attempting to take their courses through distanced online learning. In terms of water and sanitation, many reserves lack access to safe water, which makes proper sanitation and hand washing a challenge. To combat this, sanitizers and bottled water must be purchased, but these are expensive in remote communities and sometimes simply unavailable. Looking at food security, we see that First Nations and Inuit households experience extremely high rates of food insecurity. A disruption to food supply chains was a really big concern at the beginning of the pandemic, but since panic buying has pretty much stopped in Canada, that luckily hasn't been an issue and will hopefully remain that way. However, the pandemic has caused unemployment to skyrocket, making the already expensive foods in remote communities even more unaffordable and exacerbating an already existing food crisis. Indigenous individuals also experience unique health conditions when compared to the general population. And many of these can be traced back to residential schools where children were chronically malnourished. So studies have found that prolonged malnourishment leads to lifelong health conditions, including an increased prevalence of obesity, which we know increases the severity of COVID symptoms, and type 2 diabetes. Chronically malnourished women are more likely to give birth to children with chronic health conditions, which are subsequently passed down to their children. So these health conditions are present today in many Indigenous people who did not attend residential schools, and regardless of whether they live in urban centers or remote communities. So both TB and chronic kidney disease can also cause severe COVID symptoms. And as you can see, First Nations individuals are twice as likely to suffer from chronic kidney disease, and Inuit are 300 times more likely to contract TB. In terms of mental health, many communities are experiencing high rates of youth suicide. These communities tend to have higher rates of depression and substance abuse disorder. So depression derives from the systemic barriers they face, and substance abuse disorders arise as a coping mechanism. The lack of support for mental health and addiction in these communities then just perpetuates this vicious cycle. Many of these communities have taken steps to quarantine themselves to prevent the spread of COVID, which has meant that no outsiders, including friends and family living in urban centers, are permitted to enter. So this increased isolation has further impacted mental health in individuals already struggling with severe depression. So before concluding, I want to talk about some of the limitations, what's been done to address these issues, and what needs to be done in the future. So a lot of the statistics I've used during this presentation are incomplete due to a complacency towards data collection on this demographic. And this, of course, makes it difficult to understand the full impact that the pandemic has on all categories of Indigenous people. But what is apparent is that Indigenous communities have largely taken care of themselves during the pandemic. They've come together to make sure the elders in their communities have the things they need while isolating, Individuals with specialist knowledge, such as the practice of jarring and drying fresh foods, are providing virtual classes for free to help their community members. And many have also set up blockades on highways to prevent outsiders from bringing the virus in, and they purchased their own PPE. In terms of financial government support, initial funds were largely inadequate, and many communities chose to purchase their own PPE due to slow government response. Although seeing figures in the millions seems significant, it actually worked out to be about $220 per person, which really isn't going to get anyone very far. However, since June, some additional funding has been rolled out, and the $650 million fund on the right has been invested in creating long-term resources and support, which sounds really positive, as funding and resources are generally provided on a short-term basis as a response to a crisis over a period of a few weeks. But it's still too early to know what the effect of this funding will be, but it'll be really interesting to keep an eye on that and find out. So along these same lines, future funding should be allocated to Indigenous-led organizations, including friendship centers, which provide services to Indigenous persons living in urban areas, as well as remote Indigenous-led organizations that have a much better idea about what the needs of their own communities are than the federal government does. And as I mentioned, we also really need to improve data collection, not just on First Nations living on reserves, but also the other 80%. And some organizations right now do a really good job of collecting this data, but they don't have the means to do it on the same scale as the federal government. Qualitative data is also a really valuable research method, but using a combination of both of these together creates really impactful results. So it's extremely important to make both a priority. All right, so that's where I'll leave things. Thank you.
Awesome. That was great. Thanks, Alexandra. We will open the floor to questions now. We've got a couple for Alexandra in the Q&A text channel here. So the first being, it seems that many of the problems you've identified are systematic. How should we push the government to recognize their systematic problems, such as poor data collection?
Yeah, so that's really difficult. Indigenous and non-Indigenous groups have been pushing for changes to systemic problems for a really, really long time. So in terms of COVID data, the goal is to develop an independent Indigenous-led nationwide statistical collection agency. So the COVID data being collected right now is through Indigenous Services Canada, which is actually quite a new government department, but it hasn't yet done a lot to fix the problems that were present before. So I think it just really comes down to awareness of the public about these issues. And I think by improving awareness, there may eventually be enough pressure on the government to relinquish their control over this to organizations that are less complacent about the data.
Great. There is a follow-up question from Melissa as well. Aside from the government body, what can people outside Indigenous communities do to help fight these systematic problems, particularly in relation to COVID-19?
Yeah, so again, I think it's public perception. A lot of people kind of participate in victim blaming, and they don't really understand that a lot of the issues these communities just face are systemic. So again, spreading this information, and I think also changing the curriculum in schools a bit. I think it's usually kind of framed more in a historical context, like this is what we did do to this group in the past, and it doesn't really focus on what's still going on now. So increasing awareness of that. And then in terms of COVID, I think just staying away from some of these communities so that we don't spread anything. So Haida Gwaii in BC just a while ago, they were really petitioning to have tourists stay away. And then I think also looking into just local Indigenous communities in your area and just reaching out to them and asking what you can do to help.
Awesome. Thanks, Alexandra.